Okay, we're going to go over an interesting case of a chronic shoulder dislocation. So this is a 25-year-old male who came into the emergency department telling us that he had a chronic shoulder dislocation. He says he has a seizure disorder. It was unclear if he was on any anti-epileptics. He has recurrent dislocations and had some unknown procedure previously. Told he needed surgery, wasn't taking anything, and denies any neurological symptoms or concerning sort of emergent features. And it's really affecting his quality of life. He can't work because he basically can't use his left arm. So in physical exam, he looked kind of like this. There was a surgical scar. His range of motion was profoundly limited. Really, you can't range him at all. His nerves are intact, right? So you can test the median, ulnar, radial, musculocutaneous, and axillary nerves. And they had good radial pulses, and his sensation was intact. This is his initial x-ray. So the arrow is pointing towards this dramatic Hill-Sachs deformity. And then the left screen, you can see I kind of outlined in pink the glenoid, and then on the right screen in blue, the humeral head, right? These are just ridiculously abnormal. There's a lot of degenerative changes and remodeling of the bone related to this chronic dislocation. If you want to know what normal looks like, I would pause this and change tabs over and Google normal shoulder x-ray. A CT was obtained. This is an axial cut. The arrow is pointing to the glenoid, and you can see the entire humerus is in front of the glenoid, not articulating with it. And then those two yellow markers are measuring the size of the Hill-Sachs deformity, and you can just see how abnormal the humeral head shape is here. It's really quite profound. So let's talk about chronic shoulder dislocations. They're pretty rare, right? Most patients come to the emergency department and they get reduced. Recurrent dislocation would be a different thing from a chronic dislocation. So it's kind of controversial, but most commonly accepted definition is 3 weeks. More frequently seen in elderly patients with sort of muscle atrophy and senescence. Less commonly, alcoholism, seizure disorders, repetitive trauma. Most patients will typically know that they are chronically dislocated. They can tell you that. They're going to have pain, decreased range of motion, and perhaps most importantly, decreased or profoundly reduced function. They can't work. Radiographs are the initial imaging modality of choice. CT scan is kind of a better way to evaluate the osseous structures, useful for surgical planning. Associated, associated injuries includes chronic Bankart and Hill-Sachs lesions, glenoid bone loss, rotator cuff tears, acromion and proximal humerus fractures, and then neurovascular lesions are not really well reported due to the rarity of presentation. Management is very difficult, as you can imagine. There's no consensus among orthopedic surgeons about the best or optimal management for these patients. Remember, the goal is to return them to function of that shoulder. And how do you get there, right? So there are a lot of surgical options: closed reduction, open reduction, Bankart repair, ladder jet procedure. Sorry, that's a typo. Coracoid transfer, bone grafting, hemiarthroplasty, and reverse shoulder arthroplasty. The last of those being the one that I'm most familiar with. So management decision making is complex. Okay, there's no clear answer. The goal is to restore function, but that ability to do so is variable with a high failure rate. So in the case of our patient, he was seen by the orthopedic surgery service. They requested a CT that I showed you. They agreed this guy definitely needs surgery, but not emergently in the hospital. And unfortunately, he left our service and never came back. There's no further record of what happened to this patient. So 3 key points about chronic shoulder dislocations. They're rare and not well described in the literature, limited to case series, but the best definition is greater than 3 weeks of the glenohumeral dislocation. Radiographs are sufficient in the ED, but CT is useful for surgical planning, and management decision-making is complex, and no consensus on best surgical intervention.